right, I believe it's 10:45 and we have a lot to talk about today. So we will go ahead and get started with our third presentation for the day, which we have modeled after the good old fashioned Wizard of Oz saying, vaccines and masks and surveys, oh my. We have fielded, particularly recently, a lot of questions about vaccines and what we can require employees to do, which my esteemed colleague Tara Eberline and I have worked diligently to tag team for our clients. And because of all of these questions, we thought a presentation today on these various topics might be a good idea. So we're going to cover a lot in the next 45 minutes. We are going to start out with a brief conversation about the anticipated CMS regulations requiring vaccines for healthcare employees. I will admit I was very nervous that they were going to drop regulations last night, but they did not. So it will be the anticipated regulations, the executive orders requiring vaccines, and the OSHA healthcare ETS. Tara is going to cover, and we're going to go into some individual company mask mandate or company vaccine mandates as well. I'm also going to spend some time talking about HIPAA and COVID-19 vaccinations. While Brooke covered our HIPAA presentation earlier, I couldn't get away without talking about HIPAA for a little bit today. We're also going to talk about some staffing shortage issues and questions, as well as some infection control surveys and best practices. So to jump right into it, on September 9th, 2021, President Biden announced a COVID-19 action plan and path out of the pandemic, which aimed to reduce the number of unvaccinated individuals by increasing the number of individuals subject to vaccine mandates. Among the provisions in his plan, he announced that his administration would impose new vaccine mandates on healthcare staff or healthcare workers employed at most Medicare and Medicaid certified facilities, which is going to include various different healthcare providers, hospitals, dialysis facilities, ambulatory surgical centers, and home health agencies. He also announced as part of this plan that they're going to condition continued payment or participation in the Medicare and Medicaid program on the vaccine mandate. So who does this exactly apply to? This has been a common question. While we don't know the full extent, because we don't exactly know, and CMS has been keeping what they plan to issue in this vaccine mandate regulation pretty close to the vest. So we're going to have to make a couple of speculations here today. But what they did in their press release announcement was linked to a page on the CMS website that listed out multiple healthcare providers. And so that included all fee-for-service facilities, hospitals and inpatient facilities, which is acute care, critical access hospitals, inpatient rehab facilities. It also is outpatient facilities, ASCs, comprehensive outpatient rehabilitation facilities, federally qualified healthcare centers, rural health clinics, long-term care facilities, durable medical equipment suppliers, home health agencies, hospices, clinical labs, and ambulances. So it's going to likely cover a wide range of people. The other piece of it that we also believe it will cover is your clinical staff, your volunteers, all non-direct patient care staff is likely going to be covered under this vaccine mandate. And individuals providing services under arrangement has also been mentioned in some of the blogs and discussions about what the vaccine mandate will cover. CMS has speculated that this vaccine mandate will cover approximately 50,000 providers and a majority of the approximately 8 million healthcare workers in the United States. So it's going to be covering a lot of people. The purpose of this new requirement is to protect the vulnerable and the elderly patients in healthcare facilities from the indirect threats posed by unvaccinated individuals as a source of COVID-19 outbreaks and infections. We certainly saw while the Delta variant was raging that there were more outbreaks in facilities with employees or with where there were employees that were not vaccinated, or those higher populations of unvaccinated employees. And so this is seen as a force to try and resolve the fact that we're seeing increased outbreaks in facilities with low percentage of employees that are vaccinated. We continue to remain in the dark, as I mentioned, as to what exactly is going to be required. What we do know is that CMS has said in the last week they expect these regulations to be released soon, sometime in late October. But there will be a final rule with a comment period is expected to be announced later this month. So a couple of different speculations as we work to try and prepare for this anticipated CMS vaccine regulation is that they haven't hinted at how we're going to have to report this type of information, but one reporting system could be analogous or try and build on the quarterly data collection system that was disclosed or released in a recent final rule issued by CMS. This final rule includes provisions establishing a process measure to track COVID-19 vaccination coverage among healthcare personnel and healthcare facilities, such as acute care facilities. This final rule was released on August 13th, 2021, and it established this data collection system as part of your hospital inpatient quality reporting program, which is referred to as the COVID-19 HCP vaccine coverage measure. And it's somewhat similar to the influenza HPC vaccine measure. The COVID-19 coverage measure was previously included in a December 21st, 2020 list, but it came out in this final rule published on August 13th. Under this particular measure, and I'm just going to highlight a couple pieces of it, beginning in the fourth quarter of 2021, so October 1st to December 31st of 2021, healthcare facilities such as inpatient hospital and post-acute care facilities must submit vaccination data quarterly through the CDC's National Healthcare Safety Network, and which is the same web-based infection surveillance system used to report the influenza vaccine coverage among healthcare professionals. The healthcare facilities are to report the percentage of healthcare professionals who receive complete COVID-19 vaccination course according to the measure specifications in the rule. Healthcare facilities will report this data collected by the healthcare facility during one self-selected week of each month during the quarter. The quarterly vaccine coverage rate for each facility will be based on this data that is reported, and CMS will then publicly report that COVID-19 healthcare coverage rate for each healthcare facility. Whether the vaccine mandate will build on the quarterly CMS vaccine coverage or this particular thing is yet to be determined, or if they will do something similar to the EEO1 data collections. What we do know is this particular final rule is that it is specifically said in this final rule that it is not intended to be a mandate to have a vaccine mandate at your facility, or that all healthcare facilities must be, or healthcare employees must be vaccinated. But you know, the American Hospital Association issued a letter or an advice memo to CMS earlier or late September, where they did actually encourage CMS to adopt this as the reporting requirement for the anticipated CMS vaccine mandate, because if we're going to have to do it this way, it's a good way to track it. So it's again yet to be determined how we're going to track and report for the CMS vaccine regulations, but this is just one potential avenue. Enforcement of the anticipated CMS vaccine regulations. Again, don't know, but what we do know is that CMS has reported that it intends to adopt a progressive approach to enforcement of the vaccine mandate, similar to the enforcement approach used with respect to nursing homes that do not adhere to various requirements. So we can speculate that the enforcement approach may be similar to the enforcement approach that CMS has used with nursing homes. So this various stepped approach would consist of a couple of things. One, providing notice to facilities that are not in compliance with the mandate. So right out of the bat, you'd get some sort of notice, which is what the American Hospital Association asked for in their memo to CMS. Please give us notice when we're not in compliance. The second step would be then to assess civil penalties based on the failure to comply or multiple notices of failure to comply. The third step would be denying payment to non-compliant facilities, and then ultimately removing the facilities from the Medicare or Medicaid program for non-compliance. So hopefully we see a couple of a stepped process here when they do release the CMS vaccination requirements when it comes to an enforcement mechanism to give facilities an opportunity to come into compliance without facing massive civil penalties or denial of payment. So how do we compare, or how do we get prepared for compliance? We've seen numerous questions regarding the vaccine mandate. As I said, CMS has been playing this hand very, very closely to the vest and giving no poker tells whatsoever about what we can anticipate, other than they do expect it to somewhat align with other COVID-19 requirements. So we still aren't sure whether there's going to be any sort of request, how requests for religious or medical exemptions from the vaccine mandate are going to play out. We don't really know if there's going to be accommodation for hardships. We don't know if there's going to be alternatives. So what we can do is prepare and implement or review your existing vaccination policies, whether you have a flu vaccination policy out there to review to get prepared for how we're going to come into compliance with this. Frankly, many, and Tara will get into this a little bit, as many providers have already begun imposing COVID-19 vaccination mandates. The Brown School of Public Health has issued a tracker in which they track hospitals for those hospitals or hospital systems that have imposed their own mandate. And as of this morning, 293 hospitals or hospital systems have imposed a full vaccine mandate. So then the question is going to be whether the vaccine mandate that you've already imposed will come into compliance. But being well versed in your own vaccine mandate or vaccination policies will be helpful. The big component is going to be educating your patients or residents or staff about the importance of obtaining a COVID-19 vaccination, the importance of complying with these particular regulations. I mean, it's not as simple as just saying no. We receive a lot of money from federal programs. So, we want to make sure that we're falling into compliance. And making sure that we understand the vaccine mandate, but the uncertainty has certainly been cause for some stress in the healthcare world and environment. And until we get those regulations, hopefully at the end of October, we will have a better idea of what that vaccine mandate will include.
Well, good morning, everyone. I'm Tara Eberline, and certainly appreciate the opportunity to chat with you a little bit today. Wanted to talk through a couple of the other new changes, new regulations, executive orders, and related obligations that are out there for healthcare employers and other employers generally that may impact your workplaces. We have had a wild year, as you all have had undoubtedly, with tracking and following and doing our best to understand each of these new changes as they've been rolled out. As Amanda explained, President Biden issued an announcement earlier that there's sort of this three-pronged approach that he's taking with respect to the implementation of his goal and the administration's goal of vaccinating as many individuals as possible. So Amanda talked about the CMS regulations that we expect any day. The second piece here that I'll talk about is an executive order that covers federal contractors. And this executive order has now been issued as of a couple of weeks ago. And we've received a little bit of guidance with respect to how it works, although there's still some unanswered questions, as there always are when we get new requirements that come from the administration. So what we do know is this: the new executive order requires government contracts, either new government contracts or those that are being renewed, which happens essentially every year, as those of you who have these contracts are aware of. They all must comply with the requirements published in this Safer Federal Workplace Task Force document that Amanda had mentioned earlier. So essentially, from a timing perspective, the executive order says that this new COVID language, the language with respect to the vaccine mandate and the other requirements for federal contractors, will start to roll into new federal contracts effective November 14th, 2021. And for renewals, as those come up, starting October 15th of 2021. So for those of you who have numerous contracts and that may have some that are coming up for renewal here, you may be seeing this new language in those renewals starting very soon. The deadline to comply, in other words, to have your staff be fully vaccinated, is December 8th, or the first day of that new or renewed contract. So they've given a little bit of a window here for those folks who are going to be impacted by this very beginning. If they have new contracts starting very soon, you have until December 8th to get your employees vaccinated. The explanation of or description of who's covered by this new executive order is pretty darn broad. When we talk about the types of contracts that are covered, there is one important exclusion, and that is that contracts just for goods are excluded from the requirement. So if the government is simply purchasing goods under a federal contract, it's not covered under this executive order, but essentially every other federal contract is likely to be. If we can go to the next slide, Amanda. So when we talk about who is covered from an employee standpoint, there are going to be a wide variety of employees that are going to be covered. And that includes not only the people that you might first come to mind, which would be those federal contractor employees who are working on a covered contract with the government, but also those who perform duties in connection with the covered contract. So think about administrative tasks, your HR, your accounting, your other folks who may have some connection to the covered contract but aren't working directly on it. And then the perhaps biggest broadening of this definition that's included in this executive order is that any employees who are working in the same workplace as covered employees also have to be fully vaccinated. So even if you have a group of employees who work on your federal contract and you have another group of employees who don't work on that federal contract, but they work in the same physical location, even those employees who don't work on your federal contract are required to comply and be fully vaccinated as well. Interestingly, individuals who are working on a covered contract remotely from their residences are also subject to the vaccine mandate, even if they never come to a covered contractor workplace or a federal government building. So again, broad definition of who is covered here. Generously, they did indicate that the masking and physical distancing portions of the guidance don't apply if you're working at your own home. So you're not required to stay away from your pets or your children while you're working at home. Exclusions, we talked about those. Those grants or those contracts that are just for goods would be excluded. From a requirement standpoint, the COVID-19 vaccination, of course, is the big requirement that is getting most of the attention, but there are a couple of additional requirements as well that it's important for you to understand. One of those is that not only those covered contractor employees, but also your visitors need to comply with masking and physical distancing requirements while they're in those covered contractor workplaces. And the guidance that's out there with respect to how to do that is to put up a sign that says, if you're not vaccinated, here's the rules with respect to masking and social distancing. And if you are vaccinated, here's those other rules. Right now, for what it's worth, the masking rules indicate that if you are in an area with high or substantial community transmission, then masking is required indoors regardless of vaccination status. And as many of you may know, the entire country still falls within, essentially the entire country falls within that substantial or high community transmission definition. So masking is required indoors for everyone. distancing right now is not required for those employees who are vaccinated. Okay, so moving then to the current OSHA healthcare ETS, as many of you know, in June, OSHA issued its first emergency temporary standard that we've seen in a long time, frankly, in decades, and that applies to healthcare organizations or those companies, those settings where an employee provides healthcare services or healthcare support services. There is a sort of workflow document on the OSHA website that describes who's not covered by the OSHA healthcare ETS that might be helpful if you're not sure whether your organization falls within the ETS or not. We've included here on the slide some of those categories of employees or workplaces that are not covered by the ETS. So if you're a retail pharmacy, if you are a true ASC and you're screening everybody before they come in and you're not permitting people who have COVID to come into your building, then the OSHA healthcare ETS does not apply to those employees. So talk about the key requirements of the ETS. To buzz through those, number one, we're required to have a written COVID-19 plan that includes a designated safety coordinator. So we need to identify, okay, who is our safety coordinator with respect to COVID-19? Who's our expert on this? That's going to be sort of our go-to person. We need to do a hazard assessment, and we need to put some policies in place, written policies in place to minimize the risk of transmission. Lots of these things I suspect many of your workplaces have done over the past year or more, but it is important that if you haven't done it yet, that you make sure you go through sort of each of these key requirements and ensure that you are compliant with them if you are not excluded from coverage under the ETS. So issues on or requirements with respect to points of entry and PPE. I don't want to go through all of those in detail, but you can see some of those things noted on the slides there. The OSHA ETS website does have some pretty helpful information. There's a fact sheet and there's a summary sheet that walks through some of these requirements. And then of course there's the full length regs, which are just delightful reading as well. Most important though, I want to talk about the health screening and medical management section. And that is, we do need to be screening employees before every shift. We do need to notify employees who have been exposed. And then there are specific requirements with respect to removal of employees from the workplace and who and how we need to pay employees who have been removed from the workplace. And there's essentially 3 tiers required within the ETS for payment for paid leave, essentially for employees. So if you have if you have under 10 employees, we don't need to pay employees when they are excluded from the workplace, whether that's because they were exposed at work, because they've tested positive, or otherwise, we're not required to pay them. If you have from 10 to 499 employees, then we need to pay the employee their normal wages up to $1,400 per week. But beginning in the 3rd week, then we can reduce that down to 2/3 of their pay, up to a maximum of $200 per day. So there's a slight reduction that happens after 2 weeks of removal. There's not a limit on the number of weeks that an employee is eligible for that pay. And so if you have somebody who has pretty severe symptoms or who's been hospitalized or otherwise, we're required to continue to pay them for quite some period of time. 500 employees or more, we're required to pay the employee their same regular rate of pay up to that $1,400 per week until they are able to return to work. So pretty significant there. One important difference between the requirements under this healthcare ETS versus last year's FFCRA paid leave that we talked about and that you may have been paying your employees under is that under the OSHA ETS, we are permitted to deduct the pay that we're providing employees when they're gone for these reasons from their PTO or from their vacation or sick leave. So this doesn't have to be new leave on top of what they otherwise were eligible for or entitled to under our normal policies. That's a change and is a helpful one. So what some employers have been thinking through though is, okay, so you have your super responsible employees who don't take time off and they accrue this nice vacation bank or nice sick leave bank, then they get COVID and they're required to drain their bank. Whereas our sort of frequent flyers who are gone a lot, who use a sick day as soon as they get it, always something going on. If that person gets COVID, we still have to pay them too. And so we struggled a little bit with the fairness of that, frankly, and how do we figure out, how do you handle that situation in a way that doesn't really penalize our most responsible employees who have that nice bank that they've put together. One option that some employers are thinking about or have implemented is that for COVID leave purposes only, or you could do it more broadly, but what you could say is for purposes of implementing this requirement, you could allow employees to go upside down in their paid leave bank. So even if they don't have paid leave available today, if they need paid leave due to the OSHA ETS, you could deduct that from their from their bank and maybe have them go negative for some period of time until they're able to come back. Certainly wouldn't ask that employee to pay it back if they ended up departing from you before they were able to return or pay back that paid leave. But for some circumstances, that might be a helpful option. One other comment on the paid leave piece, and this is different too from what last year's rules were under FFCRA. We do have to pay employees if they get COVID, no matter where they get it. So it's not just if they're exposed at work and get sick. It is if they get sick and test positive with COVID, we need to pay them while they're out. If they are exposed at work but don't test positive, we also need to pay them. So if we remove them from the workplace because of a workplace exposure, we need to pay them for their time. If an employee needs to be removed from work because of a non-workplace exposure, so they go to a kids party or they go to a restaurant, or for whatever other reason they are exposed at home or outside of the workplace and can't come to work, then we don't have to pay that employee for that time off. So that's a distinction that I think is an important one to remember as well. All right, so setting aside the current OSHA ETS, there is the third branch of the President Biden administration plan to increase vaccination of employees or individuals across the country. And that is the new OSHA ETS that has not yet been announced or implemented, but we know it's coming soon. And that new OSHA ETS has been announced to be requiring vaccination or testing for employers with 100 or more employees. The small amounts of information we've heard so far suggest that weekly testing will be an option. We think that will likely be at the employer's expense, although it's not entirely clear yet. We'll see soon what happens from that perspective. This ETS was delivered to the White House yesterday. And so I, much like Amanda, was a little concerned that we would get new information either late last night or early this morning that we would need to figure out to be able to share with you today. But unfortunately, we don't have it yet. And so keep your eyes and ears open because we anticipate that this information will be coming very soon, perhaps even in the next few days. So setting aside those mandates, the sort of federal government related mandates, we also want to talk a little bit about individual company vaccine mandates, because we have lots of clients who've decided whether or not these federal requirements apply to them. They've made a decision as a company that this is the right thing for them to do, to mandate vaccinations for their employees. It is clear under the law at this point that the federal anti-discrimination laws do not prohibit employers from doing this. So you are permitted to require COVID-19 vaccinations for your employees if you decide to do so. There are two circumstances, however, that we do need to consider for exemptions for employees who are not able to get the vaccination. And that would be, number one, employees who have a religious objection to doing so, and number two, those employees who have a disability that would interfere with their ability to get the vaccination. So before I talk in more detail about that, I do want to just remind you all that there is the CE credit code that's popped up on your screen. You may also get a pop-up here soon indicating or asking you whether you are still paying attention to the deal. Or to the presentation. And if you don't see that pop up, please feel free to enter that number into the chat and we'll make sure that you get your credit. So back to individual company vaccine mandates for a moment. The two exemptions that we need to think about are disability and ADA. One of the things that's interesting in the law is that the definition of undue hardship is different for a disability related exemption and a religious related exemption. And so what we're required to do as employers is accommodate an employee who cannot get the vaccine or cannot do something else in the workplace due to a religious reason or disability related reason, unless doing so would pose an undue hardship for us as an employer. There's some guidance out there, fortunately, from the EEOC with respect to what counts as an undue burden. And again, that standard is different for religious accommodations and disability accommodations. And so frankly, there's a pretty strong argument to be made that it may be that there are circumstances under which some employers will conclude we really can't accommodate these religious accommodation requests, but we will accommodate the ADA disability related requests because that standard is a little bit different. If you find yourself in that situation, if you are going through the process of receiving requests for accommodations for employees who say, I can't get the mandate or get the vaccine and I need an exemption from the mandate, whether that's your own personal mandate or that's a federal contractor mandate or that's a CMS mandate or otherwise, we still need to think about those reasonable accommodation requests. And what I encourage you to do is have a standard process in place. So ask the employee to submit something in writing, ideally, that says why they can't get the vaccine or why they need an accommodation. On the ADA side, we might ask for some documentation from their doctor. On the religious side, it's more of an open question with respect to what sort of documentation might be appropriate to support that request, but it might just be a written statement from the employee saying that explaining their religious belief and how the vaccine would be contrary to that or inconsistent with it. What I'd encourage you to do is ensure that you have a consistent set of decision makers who look at those across your organization wide if you can, so that we don't have one more flexible supervisor who says, sure, I can accommodate anybody, and somebody else who says, absolutely not, this is a safety issue and we're not going to accommodate. Let's try to be consistent with the way that we're thinking about these and have a general consistent philosophy as an employer with respect to what we can accommodate and how we might do it. Things you want to think about, can the employee requesting an accommodation work remotely? If so, that's probably going to be a reasonable accommodation under the circumstances. Is there a different position where they would be separated from people, or they could be remote, even in a different position? And then the other thing, of course, that's going to come up, I think most frequently probably, is would weekly or more frequent testing be a potential accommodation? And the answer to that might be different from place to place and employer to employer. But as you walk through that, if you are in a position where you are making decisions to decline requests for accommodation, I would encourage you to reach out to your attorney about it, or call Amanda or myself, and we'd be happy to kind of walk through that process with you, so that we can help you minimize your risk to the extent that we can, although obviously there's some challenge there, and at some point we'll have to make some difficult decisions. So that's the individual company vaccine mandate issue. I'm going to swap back to Amanda, and she's going to chat about HIPAA a little bit.
Yep, and right before I move on from this slide, I will remind everybody one last time the code you need for your CE credit is on this slide, and I'm going to move on in 3, 2, 1. All right. Maybe no. All right, there we go. Okay, so one of my all-time favorite things that has happened from HIPAA or from COVID-19 is the increasing questions about, well, isn't that a HIPAA violation when someone asks about my vaccination status? I swear, I've gotten this question more often than I even care to count. And actually, this morning when I was doing some final preparation for this presentation, I went and looked, and in May, one of the most popular Google searches was, is it against the law or against HIPAA to ask about my vaccination status? So this has been a popular question across the board when it comes to vaccination. And I've decided, one of my colleagues sent me this nifty little chart, and I've decided it is a true thing and actually applies. But out there in the public, there's HIPAA, the Health Insurance Portability Accountability Act that we as healthcare providers all know. And then there is this new concept called the Health Information Privacy Protection Act, which prohibits anybody at any time to ask you about your health information. And it doesn't exist, I think, is part of the problem. But it's been a little entertaining. And it is also, I guess, risen to the level that OCR and HHS issued guidance on September 30th to remind professionals about HIPAA and COVID-19 vaccinations. This guidance reminds the public, or us providers, that the HIPAA privacy rule does not apply to employers or employment records, which includes employment records held by covered entities or their business associates. Generally, the privacy rule does not regulate what information can be requested from employers, as part of the terms and conditions of employment. A big however, though, just because the HIPAA privacy rule does not govern this area does not mean that there aren't other federal or state laws that address conditions of employment, such as anti-discrimination laws and the like. So, it's not a HIPAA violation to ask about vaccination status. Another very big, quick reminder here is that documentation or other confirmation of a vaccine must be kept confidential and stored separately from the employee's personnel files under the ADA. So, might not be a HIPAA thing, but they still need to be treated confidentially and kept as such. Another big reminder, the privacy rule does not prohibit businesses or individuals from asking a customer or client whether they have received the COVID-19 vaccination. And it also does not prevent individuals from disclosing to their employer whether he or she has been vaccinated, or to a restaurant or anyone else. So not a HIPAA violation to do that. The privacy rule, the HIPAA privacy rule, only applies to covered entities and some of their business associates. It does not apply to other employers, restaurants, etc. So the HIPAA privacy rule does, for many people on this call, prohibit covered entities from using or disclosing health information. For example, information about whether or not the person received a COVID-19 vaccine, except with the individual's authorization, or unless it's otherwise expressly permitted by the privacy rule. There are a couple of exceptions, of course, as with everything. So some examples of permissible disclosures without the individual's authorization about whether or not the individual received a vaccine are, a couple of them are as follows, a couple common ones. That an entity is permitted to disclose to an individual's health plan that they received a COVID-19 vaccine to obtain payment for that administration of the vaccine. A vaccine or health care provider is permitted to disclose to a public health authority that a vaccine was administered on the representation that that information requested. So, say the person's name, date of birth, constitutes the minimum necessary for standard protected or for the stated purpose of the disclosure. And then we do have some situations where an individual's employer can be one of the individuals that is disclosed to, as long as certain conditions are met. And those certain conditions are that a covered entity can disclose to an employer so that the employer may conduct an evaluation relating to the surveillance of the workplace. For example, surveillance of the spread of COVID-19 within the workplace, or to evaluate whether the individual has a work-related illness, and all these following conditions are met. The covered hospital or covered provider is providing the healthcare service to the individual. The health information that is disclosed consists of findings concerning workplace illness or work-related illness or workplace-related medical surveillance. The employer needs the findings in order to comply with its obligations under various legal authorities, including OSHA. And the covered healthcare provider provides written notice to the individual that that information related to the medical surveillance of workplace and the work-related illnesses and will be ultimately disclosed to the employer. So there's a couple of caveats. I had the link to the guidance on the next slide, or on the previous slide, that you guys can go and look at, but a couple of good reminders that related to HIPAA and COVID-19 vaccinations. I wanted to talk briefly about staffing shortages because we're seeing some staffing shortages related to the vaccine mandates. We're seeing it related to pandemic-related burnout. We're seeing it because there's more lucrative jobs traveling from state to state and they can receive more money. And so we're starting to see almost a staffing pandemic in our healthcare industry, and it's incredibly concerning. These staffing shortages impact the ability to perform at top notch, and healthcare providers need to start thinking about contingency plans to ensure the safety and well-being of the patients and the staff. It may include your contingency plan may include deciding not to perform non-critical services, limiting admissions, moving of elective surgeries, to really make sure that the patients that are there are receiving the care that is necessary, and to embark on hiring campaigns or some type of accommodation to be aware of the fact that you're having or engaging into staffing shortages. The last thing we want you to do is to have to close a particular facility, but that may be the last case resort if you continue to experience staffing shortages and healthcare suffers because of it. With a few more minutes remaining, I wanted to remind everyone that we are seeing an uptick in focused infection control surveys at various different levels of care. Again, reminder, CMS has guidance related to infection control surveys for different healthcare facilities on their website. A lot of that guidance stems from CDC best practices. Of course, the big uptick is in long-term care facilities, but you're also seeing more infection control surveys in acute care and hospices as well. Again, your basic requirements of an infection control is providing safe care and maintaining sanitary environments and equipment. But depending on the type of care that you provided or type of facility that you are certified as, those specific safe care requirements are going to be outlined in that guidance. A quick reminder that a lot of the infection control survey also looks at the assessment of infection prevention standards. So your screening upon entering, your implementation of source control measures, social distancing, PPE use, improvements in ventilation, COVID-19 protocols, all these different pieces are looked at in an infection control survey when they come knocking at your door. So again, good reminders with infection control surveys. You're going to be expected to be in compliance with the current CMS guidance in effect at that time when they are knocking at your door. So you want to pay attention to when guidance is updated. For those different facilities that there's survey tools out there, those CMS focused infection control survey tools can be used for education and self-assessment. If they aren't knocking at your door, it might be a good idea to take a look and make sure that your practices are up to snuff. As Tara kind of mentioned, and as we've been talking about today, we wanted to give you a couple of quick reminders on routine infection prevention and control practices. Again, reminders per CDC, masks should continue to be used in all healthcare facilities, post visual alerts on your doors so people know. Screen, CDC has recommended that you establish a screening process to everyone that is entering into the facility to make sure that they haven't had a recent positive COVID-19 test, that the symptoms of COVID-19 or that they are asymptomatic or haven't recently experienced symptoms of COVID-19 or that they don't meet the criteria for COVID-19 quarantine or exclusion from work. A couple of really quick reminders regarding testing. Please stay apprised of your local and national testing requirements. For example, for long-term care on September 10th, CMS updated the routine testing intervals and to be based on the level of community transmission. So again, CDC recommends that anyone with even mild symptoms of COVID-19, regardless of their vaccination status, should receive a viral test. That's CDC guidance. And then two, when you're experiencing multiple cases in your facility, CDC recommends that you expand your COVID-19 testing, and if possible, testing should be repeated every 3 to 7 days until no new cases are identified for 14 days when you've had multiple cases within your facility. I'm not going to spend a lot of time on this slide. Clayton Kaiser discussed this on our first panel, but a couple of reminders related to immunity documentation or immunity. And just, again, I can't get through a presentation without telling everybody, make sure you're documenting all your different practices, the changes in those practices, what you were relying on when you made changes, so that you know if we do start to see lawsuits that they are that you have the documentation and you're not relying on memory. To quickly wrap up here, we are seeing this thing called long COVID now, and it's actually been defined by the CDC. It's people with a range of new or ongoing symptoms that can last for weeks or months after they have been infected with the virus, and it can worsen with physical or mental activity. The symptoms are the symptoms of COVID-19. But the DOJ and HHS has recently released guidance regarding long COVID, that it can be a disability under the ADA, Section 504 and Section 1557, if it substantially it limits one or more of your major life activities. This is going to require an individualized assessment for it to be considered a disability, but people whose long COVID qualifies as a disability are going to be entitled to protections from discrimination and may be entitled to reasonable accommodations. So that was kind of an interesting to have a definition, and now this piece of it that related to guidance from the DOJ and HHS. So with that, I know we are out of time, and so thank you to my esteemed colleague Tara for doing this joint presentation. If you have any questions, please make sure that you include them in the chat. We will make sure that they are addressed. And with that, I will turn it over to my colleague, Mr. Dick Hay, for the fourth presentation of today's seminar.